Hello everyone, welcome back to our study of mind rubrics, and let's start with our rubric for today, that is croaking. So croaking is like a frog croaks, no? So it the rubric actually means that the patient is making a croaking sound. Hmm? Or croaking can also be the sound of a crow. Hmm? So when animals such as this is what croaking means. When animals such as frogs, crows croak, they make deep, rough sounds. To make a deep, harsh sound or to speak in a hoarse, throaty voice. That is what croaking means. Hmm? So, how, how do we see it in patients actually? So, generally, the croaking noise, all this is associated um, in children, especially pediatric age group below um, below 2 years, non-communicative children. There you may see that the child is making such a noise. It may be like a grunting noise during sleep because of some respiratory distress like stridor. So just to give you an example, I have I hope yes, so I have taken this video. So how do I shift? So if you can hear this noise, just wait a minute. Okay, I'll just play the video. I think you'll have to only hear the noise.
Grunting is a noisy breathing sound. Your baby may grunt to keep air in the lungs.
So this is what the noise is like, huh? Here in the video she's saying grunting, yeah, which is also a very similar noise to that of croaking, which you especially see in the pediatric age group. Okay, so that is one form of noise which you will especially see in the remedy that is given by Kent for this is Cina. So Cina, we all of us know that Cina is for pediatric age group. Cina has weeping, piteous weeping. The word that is written in our materia medica is piteous weeping, resembling lot of pain. So grunting, croaking is also out of lot of pain. This kind of noise where the patient is expressing pain. So Cina, like Chamomilla, Arnica belongs to Compositae family, and all these Compositae family have a lot to do with pain. They cannot tolerate pain. They are intolerant. They are the topmost remedies to be considered when pain is the most important thing in the patient. So that expression of pain in Cina is especially in the form of grunting and irritable, cranky, weepy, continuously weeping. So this grunting is what differentiates it from Chamomilla, because Chamomilla is also irritable, cranky, etc. But Chamomilla is more screaming out of and you can see the anger, and the manner of shouting of the child is such that you will also get hurt. Arey, how loudly he is shouting. And Chamomilla is better by carrying, while Cina is not better by carrying. Why? Because Cina is especially crying out of worms, because there are worms, and because the worms are irritating the child, therefore the child is always itching the nose, itching the anus, itching on palate. This is what irritation means, when there is constant like of like that, and putting fingers in anus, itching, scratching, all of this is what is Cina. Irritated, cranky, irritable, not so violently angry like Chamomilla. Chamomilla is more violent, hitting, striking. Cina is more irritable, cranky. The expression of the pain is in the form of grunting. Chamomilla is in the form of shouting, hitting, striking. Cina, it is in the form of itching, scratching, continuously crying in a low tone, always irritated. If you try to disturb them, then they will cry to express their pain. Oh, it went so bad. This noise you see of crying, that is what is Cina. That is why croaking. That's what croaking means. The next remedy is Cuprum Metallicum. Now, Cuprum Metallicum, there are only 2 remedies given by Kent. Now, Cuprum Metallicum seems to be indicated, as all of us know, in convulsions. No, it's the one of our topmost remedy for convulsions, spasms, etc. And one symptom we all learn, that is what in Cuprum Met, that the convulsions began after eruptions have been suppressed. But if you actually read the proving, you will understand that there is a particular type of fever that is suppressed. Fever rash is suppressed. So, for example, the most common fever seems to be scarlet fever. In scarlet fever, there is red rash that comes up. Patient's tongue becomes very red, strawberry tongue, very characteristic. But if the patient is complaining of throat pain, scarlet fever is out of streptococcal infection. So strep throat, severe throat pain, redness of tongue, fever, but rash does not appear. And then the strep throat disappears and patient is developing complications. That is when you think of Cuprum Metallicum. When you see strep throat or scarlet fever, bacterial infection. Strep is a bacteria, so you will see bacterial infection sign. So what does bacterial infection sign mean? There will be very severe throat pain, but there will be also with it greenish yellow expectoration. This change in color, yellowish expectoration, greenish yellow expectoration. This tells you that there is bacterial infection and not viral. In viral, color change does not happen. Sputum is more or less colorless or white. But when you see greenish yellow, all this, then you know that this is more bacterial infection. So when you see bacterial infection, throat pain, which disappears, and then patient is developing convulsions, patient did not have rash, then you think of Cuprum Metallicum. And strep is, there is one more disease that is becoming popular nowadays, that is PANDAS. PANDAS means psychological, I don't remember the full name of PANDAS, please Google it, but basically it is psychological disturbances seen in patients after a streptococcal infection. It's becoming very common nowadays. So what are the psychological disturbances? That after the fever, the child has become very, very aggressive. Child is biting, child is screaming, child is shouting, child is hitting the nurse, child is hitting the mother, child is troubling the mother, child has become very obstinate. What happened? After this infection, he's become very irritable, cranky, violent, hitting, striking, shouting in a strange manner. He shouts in a very strange manner. Cuprum Met is not just given in the rubric croaking, it is also given in the rubric bellowing like a cow, making noise like a crow, like a frog. So they are creating all kind of strange noises screaming, yelling, all of this they are doing. Hmm? And also becoming very violent towards the mother, hitting the mother, biting the mother. At the same time, the child is seeming very scared. Oh my god, what is happening to me? Huh? Sudden noise, child will startle, become violent. Huh? This kind of this kind of noise patients will constantly make, and you will see the other presenting symptom will be convulsion, very severe convulsions. Huh? I actually have one patient like this. Whole day he keeps doing like this. He has myoclonic convulsions. Whole day. This kind of noise with convulsions. Child is not communicative. Child does not talk. He has this since childhood. He has not developed so many convulsions. Every day he has 4-5 convulsions. Big ones. Small ones though another 10-20. So very severe case. This kind of croaking noise along with convulsions, that is what is Cuprum Metallicum. Or milder form is, like I told, streptococcal infection. Child becomes violent. Child style likes to mimicry. Child's whole behavior changes. I don't understand, doctor, what happened. He's mimicking, creating all kinds of strange noises, laughing unnecessarily, giggling, laughing, becoming violent. Suddenly he will become very make all these strange noises, laughs, then he will become violent, then he will become scared. So fear, violence, mimicry, making such kind of strange noises, psychological disturbances after scarlet fever. Very important remedy, Cuprum Metallicum, when the child has become psychologically disturbed, violent after strep throat infection. It's becoming common nowadays. Another sub-rubric, that is in sleep, croaking in sleep, not when patient is awake, but in sleep. Remedy is Belladonna. Now all of us know Belladonna is congestion of brain, head, headache, with Solanaceae family themes, no, of fear, terror. They see all kinds of hallucinations, dreams they will have, that some kind of ghost is coming, some kind of violent things are happening, and the reaction of Belladonna to this ghost is become violent. I'm becoming scared, so I will hit. They start hitting, screaming, yelling, shouting. This kind of violent behavior is what is Belladonna. And especially you see this croaking noise in the sleep when the patient is having this kind of violent dreams. I saw ghost, and because of that I am making this noise. I am not aware. Others will tell, child is making noise in sleep. He's screaming. Then we wake. What happened? Then he will wake up terrorized. Acha, I was seeing a dream. It can also happen in adults. Not that. See, I am especially highlighting pediatrics because this rubric will be more commonly seen in pediatrics, less in male, but does not mean it will not be seen in elderly people. Not male, it can be seen in male, female, all, but elderly people also it can be seen, but more common in pediatric age group. So that's it, friends. That's what I have with regards to this rubric. I hope this helps you in your practice and you learn something from seeing this rubric. See you all soon in our next rubric. Till then, bye bye, and please do share your comments and suggestions in the chat. See you all in our next rubric. Till then, bye bye.